Good afternoon and welcome to the Brainy Boomer Lecture Series. We're so very happy that you've joined us today. In 2007, the McGill University Research Center for Studies in Aging, or the MCSA Education Committee, started the Brainy Boomer Lecture Series in order to suggest practical steps to both improve and maintain brain health, as well as to promote healthy lifestyle choices amongst the most populous generation in history. The MCSA Education Committee, which was founded in 1996, has three main objectives: identifying education needs of healthcare providers, seniors, caregivers, and the public, and to develop responses to meet some of those needs; to enhance the positive image of the aging process by addressing stereotypes and myths about aging; and finally, the dissemination of research on aging. Dr. Namie Ash, PhD of Montreal, Quebec, is acting president of Handicap Life Dignity and affiliate member of McGill University's Research Center for Studies in Aging. She was a member of the National Senior Council from 2007 until April 30th, 2011. She is a member of and former chair of the McGill University's Research Center for Studies in Aging's Education Committee. She was a chairperson of the Notre Dame de Grâce NDG's Community Committee on Elder Abuse for 26 years, which she founded in 1989. She was an adjunct professor in gerontology and social services at Université de Laval with a PhD in social work. Dr. Namie Ash has worked in the field of seniors' health and social services for the past 50 years. She has been part of many government committees and volunteer boards, including the Quebec Health and Social Service Ministry, where she produced government reports on senior abuse, neglect, and services to seniors. She has co-authored the book When Seniors Are Abused, A Guide to Intervention, published by Cactus Press, and many book chapters and scientific articles on senior abuse, as well as the book Home Care, A Love Affair, which was translated into 3 languages. She is presently an independent consultant and mentor and has done numerous volunteer positions over the year, including president of the Montreal Volunteer Bureau and member of the Program and Services Committee of Montreal's Alzheimer's Society. Before continuing, we would like to remind you to please mute your microphone on Zoom, and that if you have any questions, wait until the end of the conference, or you can write them down in the chat box on Zoom. And now I'd like to invite Dr. Namie Ash to start her presentation, Long-Term Care.
Very much, and good morning to everybody, and thank you for joining us today. I changed my topic this time because I was asked to do a topic relating to the CHSLDs and what kinds of questions to ask if somebody has to go into long-term care. So I kind of figured that probably people have more concerns about this right now because of the pandemic and a lot of the bad things we heard about the CHSLD during the pandemic. So my presentation this morning will relate to long-term care, and also a little bit to how can we prepare ourselves for long-term care right now because of the pandemic, and in the future. Is it going to change? Is it going to improve, etc.? So I've expanded a little bit on the topic. I hope that's okay. I am the acting president of Handicap Life Dignity. This particular organization that I am president of is particularly mandated to provide and try to help people get their rights in CHSLDs, public CHSLDs mainly. And we have been doing this for quite a few years before the pandemic. And we did the first class action suit, actually, which we won in Quebec and possibly in Canada, in a long-term care home, a large one, basically. St. Charles Borromée, I don't know if ever any of you remember reading about it in the newspapers. For many years, it was in the newspapers practically every week. While we did the class action suit. And we did win that class action suit. So the residents and families were actually given compensation, etc. And our main, and this is why we have a critical approach to long-term care homes. We don't assume that everything is wonderful. And so you will be hearing some critiques and what happened and what went wrong in the pandemics, and hopefully can be possibly changed by us who are listening and talking about it in the future. So I'll have the next slide, please. Caitlin? Oh, yes. So my outline is going to talk about how was the long-term care system before the pandemic? What did the pandemic show regarding the long-term care system, CHSLDs? What has the long-term care system and the government done about future predicted changes? Questions to ask: are these changes what we want, what we would like? How can we get what we want? How can we prepare for the future? And at the end of my talk, I hope there'll be some questions. I may not know all the answers, but I'm sure I can get the answers if I don't actually know them, or a possible discussion period. So I'm counting on Caitlin to watch the time and to make sure I don't go over my time. Thank you. Next, please. So what are the resources that are included within the long-term care system? I think we very rarely talk about long-term care, actually, which is quite amazing when I think about it. And I'm a gerontologist, basically. We talk much more about what's going on in the community and in the homes, etc. So right now we're going to concentrate on long-term care when people possibly have to leave their homes. But it consisted of, before, the alternative resources, which are called RIs, Ressources Intermédiaires. And these alternative resources are usually for special needs, like, for example, people with severe substance abuse problems, or there are many different kind of mental health problems, etc. So those are the alternative resources that exist. The family care homes, these are now being moved, I don't know if you're all aware of this, to basically part of the home care system, and are not anymore in the long-term care system specifically. Residences for seniors, which are called RPA, Résidences pour Personnes Âgées. These have expanded exponentially in the last years, and were a lot of cause for concern also in the pandemic, which I'll go into more later on. We have still rehab hospitals, hospitals which provide convalescent care, rehab and respite beds, etc. And we have the CHSLDs, which I'm going to be concentrating my talk on today, which are the long-term care hospitals, basically. They were called long-term care hospitals. Now they're mainly called long-term care homes. And there are three types of these. These basically are for residents who require permanent assistance and specialized care if home care is not longer possible and unsafe. So first of all, we're supposed to stay in the community for as long as possible with additional home care services. I was originally also working in home care for 11 years. I was coordinator of a very large, one of the first home care programs in Montreal, in the CLSC. And so the idea is that we hope, most people hope to stay in the community in their homes for as long as possible. And the CHSLDs are for when people are not able to do this and need to have a different type of environment, which is safe. And so it says in the writings about residential care, which kind of made me laugh, that they're supposed to provide a family life atmosphere. I don't think they do, personally, but everybody can have their own opinion about whether or not this particular request is achieved. And I think, particularly in the pandemic, they definitely have not been providing a family-like atmosphere. They could be a permanent or temporary living facility, according to what the government states, but basically they very often only tend to be permanent. They're end of life, really, facility for people at the end of their lives and should be giving a good quality of life. It says on the mission statement in everybody's home that I ever go into, it says always that this is that they provide good quality of care. Many of them, most of them, not all of them, have actually accreditations from Canada or from Quebec in terms of saying that they do offer quality of care. However, we did not find this to be a fact in the pandemic. And also, our my organization has been protested about the bad conditions of care long before they were ever, we ever had the pandemic. And in fact, we had a large conference in 2018 in which people were denouncing the terrible conditions in the long-term care homes. And we actually we spent almost a year after writing up proposals to the government, not just denouncing the bad conditions, but actually making proposals for better treatment for people living in long-term care. And these, I have to tell you that we actually met with the government and with the cabinet members of the government and discussed these proposals, and were insisting that they be done, etc. And that we were supposed to have a permanent committee with them from our organization to help them do some of these things. And unfortunately, nothing really happened before the pandemic. And of course, during the pandemic, they haven't been taken up either very much. So I'm going to tell you a bit about what has been done and what hasn't been done and what should be done, or what could be done also, all of us. So you came in perhaps just expecting me to say a few questions that people should ask about family care homes, but I'm going to go beyond that because I have to, as an advocate for quality of care from our organization. They also are supposed to offer rehabilitation, psychosocial services, which to me includes social workers, but nowhere in the government documents does it mention social workers. They talk about psychologists and community workers. They do not talk about social workers even, which is pretty shocking. And they really, I think they would offer more social care and better care if there were more social workers actually working in these facilities. Nursing, pharmaceutical care, and medical services. So I'm going to turn now to the next slide, please. Yes. So we're going to talk a little bit about what these long-term care homes are and what resources are available. So basically, there are public ones which offer total government funding. Those are totally supervised by the government CUSs now. Everybody knows what the social service centers are that we call CUSs, and or CSIS in some areas. There are 5 of them in the Montreal area, and all of the long-term care homes are under them. Altogether, there are around, in terms of the homes, there are at least 60 long-term care homes in the Montreal area. That's not in Quebec. There are many more in the province of Quebec. And there are around 35 private ones that are only private. Some of them are public-private, so some government given by the public, and some have their own private foundations also, or their own private funding. So those are called public-private, in French, public-privé conventionné, it's called, which means that the government sometimes just pays for certain public beds, or they just give government funding for services, except some services, and the buildings, etc., are operated privately, etc. And some of them are only private. So just to give you an idea, 35 are only private in the Montreal area, which is quite a lot. If only 60 basically are government funded. More and more of the residences for seniors, which are at the kind of next level down, all these huge residences owned by a lot of private companies, they are everywhere now, practically in Montreal and beyond, and in the province in general. And so many people are opting to go into those residences, and we saw that within the residences too, there are lots of problems, and there also were many problems in the pandemic because none of them were equipped in the pandemic, but I'll go into that more in a minute. There are now, the proposal of the ministry was to set up a few more senior homes, which are like supposedly CHSLD, or could be the same clientele, because the clientele in a long-term care home has to be at least 3 hours, probably more, and have and the people need permanent assistance and specialized services, which is different from just a residence, where they may just have a nurse, or they may just have 1 or 2 nurses, and they may have some people offering other kinds of services, but not necessarily have medical services and specialized services in the building. Also, supposedly, home care should no longer be possible for people who go into long-term care. That's an important thing, because basically a lot of people are not going in because home care is no longer possible, but rather because the budgets for home care are not sufficient. They have long waiting lists, and there are not enough home care resources available. Okay, so I'll move on to the next first. So I know that you particularly wanted to know about questions to ask when visiting a residence. So I was looking basically to see in the literature and in the internet, etc., what are the kinds of questions that traditionally people have been asked to ask if they go moving into a type of into a seniors residence of any kind. So these are the types of ones, and you have much more detail on the article that I sent to everybody. So you can look at it either now or later to see the additional information, because I didn't want to cover it all in my talk today because it takes too much time. But these were basically the main headings of what they ask people to look for. And there are many, many people who are specialized in helping people find places, whether it be a residence or a long-term care home. And these are the kinds of questions that they would be able to answer, for example. So the first one looks at what types of apartments or rooms are in the residence. So how big are they? How many? Are there 1 bedroom, 2 bedrooms, etc.? What does it look like, etc.? What's included in the rent price? Because you have to pay, whether you're in a CHSLD or in a residence, particularly in a residence, you have to pay rent every month. What activities are offered? This is very important. Some offer very few activities. Some offer a large variety of activities. You should look at basically what kinds of activities basically are they for? Are there some for men and women? Are they mainly oriented to women, who are the majority, etc.? And all kinds of different things that we can look at just about the activities. And are they the kinds of things which would interest the person who's going to go into the home? What kind of on-site amenities are there? For example, many of the large residences have hairdressers, and particularly the private places, hairdressers, pools, and other types of amenities, even spa amenities, etc. Another question is about the security features. This is extremely important, particularly for people who might have dementias, etc. What kind of security do they have? Can people just wander out of the place and get lost in the community? Or do they have specially coded doors that you have to know the code in order to get in and out, etc.? What are these security features of the place? What are the rules and regulations? That's the very important thing to ask when you go and do a visit. Basically, there are lots of rules and regulations. In every home, they usually have big lists of them. Make sure you read them so that you're not surprised after the fact when you actually go into it. A lot of people, unfortunately, go in a bit of a rush. There's a crisis situation that happens. The people are placed somewhere by the family or by the social workers, etc. And they really don't do enough research and information. And it's better even to visit several places if you can to make your choice, etc. If you have any choice. For the public ones, we don't have too much choice, especially in the English community, because we only have a few compared to the French, which a bit more choice, but not very much. It's basically somewhere that's within your neighborhood and within your social service center. So, for example, in our social service center, I happen to live in the west end of Montreal, but we have, I think there are about 5 different long-term care homes under ours, and they're all under the our CUS, which is the Cavendish one. Can I have more information about the neighborhood? Because when you're moving into a new neighborhood, possibly, hopefully you're not moving into a new neighborhood, because it's always better to stay in the neighborhood where you've been in the past, where there are more likely to be a local church that could come and visit or do activities within the place, etc. So find out what is in that neighborhood, what kinds of amenities, what kinds of resources, what kinds of activities, etc. could be looked into. Can I see an example of the meals and menus? Now, the meals and menus, people don't seem to know how terrible the food is when they go into these places. It's the largest complaint of the complaint committees of every single long-term care residence, and possibly even the residences. Each of the long-term care residents does have a complaint committee, by the way. And many, many complaints about the meals and the menus, and not just do you have a menu and let me see an example of it, but is there a variety of kinds of food? Because a lot of people are from different ethnic communities, as we know, in Montreal, and basically they're interested in different types of food, not all the same. And you've got to remember that these people are eating these meals every single day of their lives for the rest of their life very often, and it becomes very, very boring and annoying. And there are also special meals that you might want to have, like kosher, for example, if you happen to be Jewish. So you have to make sure that they provided these kinds of meals there, etc. Will I have any storage space? People often want to be able to store some of their things. They might have space in the place, they may not. So you need to find that out in advance. And are there parking spaces for the residents and for the caregivers, the people who come to visit? This is always a big problem in all of the places. We've actually been fighting in the last couple of years to try to get cheaper parking in all the hospitals in Montreal, and also in the long-term care homes and in Quebec in general. We pay a lot of money. If we visit somebody and we happen to have to be there for a whole day, it can cost you at least $25, which is a lot. If you're paying $25 every single day. Could we move on now to the next one? So those are the main things that people generally ask. And next, I'm going to give you the things that we're not asking and that we should be asking. The main things are covered in more detail on the article that I gave you, because they have more examples of the different things within that. So you can read that and keep that, and it's quite useful. You might find other things too on the other items on the internet, which also are helpful, from all these people who give advice, etc., about long-term care and about moving into a residence, etc., because they're interested in you moving into their residence. They don't tell you any of the bad things. They only tell you the good things. Remember that too. So what are the other questions to ask when we visit a residence, whether it be a CHSLD, or a long-term care home, or whether it just be a residence? So you have to find out what are the services that are included there. Sometimes if you're going into a residence, for example, they will tell you, oh, there's this and this and this service, but they don't also tell you that when you get a bit frailer and you might need more services, it's going to cost you more money. So people are not always prepared to kind of take note of the fact that there are always additional services to pay. In the public residences, it's not as much of a problem. It's more in the private ones, or the public-private ones. There are often additional, and also particularly in the residences themselves. I don't know if you're aware, but we have a standard amount that we pay in a public long-term care hospital, and a standard amount which is calculated on your income, etc., through the RAMQ, the Régie d'assurance maladie de Québec, how much you're going to have to pay every month, etc. depending on your income and all your assets, etc. In the private system, if it's totally private, the long-term care hospital, they can charge pretty much what they like. There isn't a rule that you can only charge this much, whereas in the public, it's much more monitored by the government, and there are rules as to how much they're allowed to charge, etc., and how it works. This you can find this kind of information if you want information about money from the RAMQ, the Régie d'assurance de maladie de Quebec. It's on the internet, very easy to find. If you go into Santé, I think I went into Santé Montreal, or Santé Quebec, it probably would be. You can find information much more about all these particular details. So that's the first question, is what services are included? What kind of medical follow-up are you going to get there? Can I keep my family doctor, for example? Or is there a doctor? How often does the doctor regularly come into the actual long-term care hospital, etc.? And how do I get to my medical appointments? All these are details, but you need to know these things as a caregiver particularly. And also if you're the person who's actually going into it. So this kind of research should be done in advance as much as possible. There's a lot of preparation to do, basically, going into one of these homes. What are the staff-resident ratios? In other words, one of the biggest problems during the pandemic was that there weren't enough, and they still aren't enough, I'm going to tell you about that more in a minute, staff available. What should they be? Basically, between the staff and residents, there should be about one. Everybody knows what is a PAB. It's orderly, basically. The orderlies do most of the work with the residents in these long-term care homes and hospitals. Basically, there should be 1 to 4 people. Now, you'll see in some of the places there are many more, which is why the service cannot be as high quality, etc. So that's one thing that you can actually ask when you go there. They will be surprised if you ask the question, to tell you the truth, and they may not immediately know the answer. But it's an important question to ask, because what happened in the pandemic and why there were so many people died, over 5,000 people died just in the CHSLDs. One of the reasons was because of there weren't enough staff. Partly because of the pandemic and partly because there were never enough staff. So I'm going to discuss that in a couple of minutes at more length when I go into the pandemic. Does it provide medication administration and help with personal hygiene, etc.? So that's an important question to ask, which every long-term care hospital or residence should be providing. In the residences, they don't provide this level of services. Does the team of professionals include rehabilitation, psychosocial, nursing, pharmaceutical, and medical? And as I told you, I just looked at what in the ministry documents, what they actually supposed to provide, and they don't even have psychosocial, which for me includes social workers. And I think they hardly have any social staff. They're basically nurses, and maybe there's one social worker, or community worker. There might be a psychologist, a neuropsychologist, either part-time or full-time in them now, some of them. But in many of them, they have very few psychosocial. And sometimes in the past, I'm not sure what the actual ratio is now, but I know that in the past, they used to have one social worker used to cover several of the large long-term care hospitals, which is pretty impossible, really, to give a good service with all these huge people. And there's often more than 100 people in one of the long-term care hospitals. Remember, there's not a few people, they're huge. with many, many people in them and many beds. And I mentioned the recreational leisure activities. I mean, there should be recreational and good leisure activities during the weekends, and not only Monday to Friday. There should be also, as I said, spiritual activities. There should be all kinds of different activities which will give pleasure to different types of people with different interests, etc. So that's an important thing to really look into. And how often are they? During the pandemic, there have been none, practically. I have to say that this is one of the most terrible things that happened in the pandemic, is that the people were totally isolated. And I'll tell you more about that in a minute. And is it a sound, stimulating, and safe environment? That it's supposed to be. Particularly for people with dementias, and 70% of the people in these long-term care hospitals actually have dementias and mental health problems. And you need special types of stimulation for those people, not just regular activities, so additional ones. Is there a family life atmosphere? Well, I kind of mentioned that already. There should be like a home, as if the person's moving from their home into, at least it's not going to be ever exactly like your own home, but it should have a family type atmosphere. Now, when you walk into these places, do you ever get that feeling that they have family life? I visit people a lot because I'm old, as you can see, and I honestly don't feel any family life atmospheres in many of these places. I also was hired for 3 years in a particular place too, so I know a lot about how they are and how they could be and how they should be. Does it have only private rooms, or are there some semi-private rooms as well? Do any have 4 beds in the room, which the old ones used to have? Now they're moving toward more private rooms and semi-private. I have to say, that's one possibly good change. Next, please. Let me look at my time. Okay, I'm better fast. So some of the main things I've mentioned already, but I'm just going to run through these quickly. The long-term care homes were too big. These are the questions which arose from the pandemic. They were too big and difficult to manage in a pandemic. They were not prepared regarding infection control programs, which was major. The residents were on lockdown for at least 4 to 5 months. Some of them are still on, because the pandemic's not over, and it's actually not going to be over for quite a while. So basically, I really feel terrible every time we talk to our friend. We're not even supposed to visit at this point, because visitors are not allowed unless they're specially trained, etc. now. And for a long time, no caregivers were allowed in from one day to the next. So imagine somebody, even somebody with dementia, who suddenly from one day to the next absolutely has no visitors. It's confusing. And they were being moved also. When there was somebody with the virus, they were being moved to another place, etc. They didn't even know where their things were. Sometimes things were lost or whatever. There were lots of problems around this whole lockdown. And there was poor quality care, and some which were actually cases of neglect, where people were died of dehydration, and they died of starvation because they were not being fed. They were not or people would just put the tray in the room, but the people weren't able to eat by themselves, for example. And a lot of this is on camera. So we saw the program on Marketplace the other day about Ontario. I'm sure we could do exactly the same program from the cameras of people that have been taking, have cameras in the rooms of their loved ones in the long-term care homes and had during the pandemic. We could find a lot, the same problems as they find in Ontario, if not more. There was an absence of staff and poor work conditions and salaries, etc. This we had already in our document that we had proposed to the government. We had told them that this was a big problem, that there weren't enough staff. So at the beginning, they kind of pretended that they didn't know about it, but they couldn't really not know about it since we produced our document. We kept sending it to all the media, etc., saying that yes, they knew about it. This was published in this time over a year before, and we even met with the ministry over a year before the actual pandemic started. So they knew about the conditions and they did nothing about them. And they still have what they have done, as we know, they've hired more staff and trained some staff, but I'll refer to that in a second in terms of the problems related to that. Staff were working on several floors, passing the virus to residents. That was the major reason. It wasn't the caregivers who were the problem because they were kicked out on day one. It was the staff working on several floors and having several jobs in different places that were passing the virus to the residents. And I came back myself from Spain during the pandemic, and nobody actually gave us any testing at the airport, which really shocked me. I would have thought that they would immediately have tested us all since they knew the pandemic was on, but we weren't set up for that. So there were a lot of things that could have been done, and they should have been testing the staff at the very least in all of the homes, right? And possibly some of the residents from day one. But at least they should have been testing the staff who had been away from day one. They would have been able to prevent that virus from spreading to so many people. Families and caregivers were not allowed visits for several months. We know that. And they're still not, to some degree. My friend, I just visited my friend. I have to see him through the fence, basically, on a nice day. But basically, they have not been allowed to visit anymore now. Still, there's an isolation again because there are more cases now in the very large long-term care home that he's in. So we still haven't solved the problems. I think people think that it's kind of over a lot of these problems, but they're still there. And are we going to be able to, are we going to have enough of what we need to prevent this? And are we going to put it in place and implement all the things that they should? We also know that there were no common norms and standards in place, which I find that horrendous, really. We do these accreditations, etc., but there are no real common norms and standards. Now, they did put in one standard from the federal government, which I liked, and they are in Ontario, they're working on new norms and standards. So we should also be doing the same thing in Quebec so that we have very specific norms and standards of care in these places. Maybe McGill can work on that. Next, please. So the pandemic unpreparedness led to a huge death toll of residents. We know over 5,000, over 6,000 people have died. Most of them, like 80% of them died alone from the virus or from ageism. We have set up a big website, if any of you want to have more information on our, in our organization. You go into handicapvdignity.ca and you'll see our website, and that we've collected articles and we put on a huge amount of information during the whole pandemic that we could give it to people. We also organized a very large petition for all of the caregivers that we could relate to who go into these homes and complaining about the fact that they wouldn't allow any visits. Finally, they did allow it after much pressure from the media and from people, organizations like us. There was no communication practically at the beginning given to residents or caregivers for months. And the communication mechanisms which are still set up are not really very adequate. Since we are caregivers of people, we hardly get any information. Loss of personal belongings, lack of the PPEs, which are the masks and gowns and all the stuff that people need. No training of caregivers for months. They should have trained the caregivers right from the beginning. And I'm hoping now that all caregivers who need to be and would like to be could be caregivers, could stay, so that instead of them being kicked out the minute there is a problem. Many staff were sick with the virus, and there was more poor communication with the social service centers who are running not social service, the health and social services, the CUSs, who are running all of these places. The same situation there was the same situation in senior residences also. So it's not only in the long-term care homes and the other resources of the long-term care, mainly in the residences. And the private homes had similar situations, in some cases worse. As we know from the famous one that most of the people actually died. I've forgotten the name now, it's not in my head, but you remember it was in every single newspaper for weeks about how terrible that situation was. And even Grace Dart, I don't know if you know that, of that long-term care home, which is one of the Anglophone homes, basically 70% of the people who got the virus actually died. This is a huge amount of numbers that have been happening that we've been horrified about. So next, please. Okay, so what's the future of long-term care system? What have we learned? Have they improved everything since it? So before placement, we need to ask these questions. Do they have trained additional orderlies, PABs, we call them, with increased salaries? Well, the biggest problem I saw, which I was a bit horrified about, was that the ones who were trained only got 300 hours of training, which is not enough for orderlies to be able to know how to help and approach and care for people with all kinds of problems like dementias, etc., mental health problems that they're having to look at, take care of those people within the places. Also, we needed 10,000 more, and we only actually recruited 7,000. So we are still 3,000 people short. We did increase the salaries. That caused a problem too, because of the union problems, because the other people didn't get the salaries increased. And there's been a lot of conflicts between the different people in different unions who are now expecting to get the same amount of money. Do they have enough of the PPEs now for future pandemics? No, they still don't, even though they should, but they still don't. If you ask the places, are they prepared for infection control with enough PPEs for everybody? No, they don't still. Some of them might, some of them don't. How are they going to treat caregivers, and will the residents have access to other personnel and activities? They treated the caregivers very badly in general. I know caregivers who are not allowed to go into the home even when their loved one died, and they died alone, and they died in very bad conditions. So I think we need to know, basically, how are they going to treat people in this situation? Because pandemics are going to be around for, some people say, for a number of years. Not on the same scale, perhaps, but there will always be pandemics that will happen. And will the residents have access to other personnel and activities? The residents during the pandemic have not had access, or very few of them have had access to other activities and personnel, like physios or people. So they haven't had any rehab, etc. So they became less mobile, etc. during the pandemic. What about respect for language, culture, food, and menu variety? These are questions that we always should ask about. We know that it's difficult to find people and staff who speak the same language as your person. If your parents don't speak necessarily English and French, or French, are they going to have a problem? So those are all the questions. Next, please. What do we have to do to have quality services? So I'm saying what still hasn't been done. We have not made it possible for most seniors to stay in their homes with adequate resources. For me, the whole issue of having better home care resources for people so that they could stay in their home, even if they have a lot of chronic illnesses, even some with dementia too, could be able to stay in their home for longer if they had adequate resources. So I think we have to advocate for more and better home care resources. And this is partly what we put in our proposals and partly what several organizations are now banding together to fight for, to change some of the ways in which things are being given. I saw it keeps being mentioned on the media that they're giving these monies and the other monies, but the people haven't actually received it yet, and it hasn't been reorganized yet. We have to remember that. We have not changed the management structures from the present model. It's been a medical model with pretty much focusing a bit on medical and nursing care, etc. But there's been hardly any social care, which people care the most about. It should be end-of-life care, making people comfortable, giving people as much quality services as possible, and also social care. And we're not getting that. We haven't had independent evaluations, satisfaction surveys that are appropriate and adequate. I've been investigating I am in touch with all the residence committees. There's no communication between the actual committee of residents in the homes and the management, who are really in charge of making sure that the complaints are dealt with, etc. This is a big problem in the homes. We've not created new alternative living arrangements. They should be creating some interesting other types of models of care. We are working on one right now that we're going to try to push for. Using Carpe Diem, I don't know if any of you know that resource. It's a very nice resource where they have people who actually have the same criteria as people in CHSLDs, but they provide a home-like environment with home care, with home services, and it's managed by a non-profit and not by these kind of complex government structures. So we're not thinking that this should replace all the long-term care homes, but that at least there should be choices, more choices that people have in terms of giving a more variety of places. Next, please. So the long-term care looks similar to what it was before, except we're more ready for the pandemic. We have made some progress, and we will probably, hopefully, have a vaccine available in the future, in the near future. We'll have a set of values and principles from the government stating how care should be given, because they've set up a long-term care committee, policy committee, which is producing its statements in the next month, I think, about these principles. But these are only appropriate if they're actually implemented. So it's one thing to read all the nice words on paper, but it's another thing to implement and be able to monitor in the homes if they're being offered. The Maison des Aînés, you've probably heard about these. They're called senior homes, but basically they are also appropriate for people with permanent end of life, or permanent problems and at the ends of their lives, etc. These offer a little hope as they're smaller, and there'll be more home-like, I think, that they're planning to set up, but it's going to take them probably up to 7 years before they're all set up, so it's not going to happen tomorrow. But they, I think, would be better than the other ones, and we're trying to push that these homes, some of them could be under community, they could be under non-profit organizations and community organizations, and not only be under the government directly. So, because we think that in some cases the community organizations do a better job. We also need to fight together for better care for our seniors and to make coalitions. And this is one good thing I think that came out of the whole thing, is I think that the senior organizations, which were usually a bit competitive and not working together, I think now more and more they are working together. We have at least 7 partners, and we also have this coalition of Régent Hébert, who is a big geriatrician and was the Minister of Health for the government for a few years, and basically we are going to join that coalition and see if we can kind of improve the quality of services. If anybody's interested in fighting for better services, please, you can contact us at any time. So there, I've come to the end, I think, of my slides. Was there anything else? Oh, how could we prepare ourselves? By keeping ourselves in as good a shape as possible, physically, mentally, and financially. Obviously, we will be in better shape. That's what I'm trying to do. I'm going to be 80 in April, and I still am trying to keep my brain sharp and to try to avoid being in one of these long-term care homes, to tell you the truth. By coming up with our own or community ideas for long-term care homes, because I think we have to put some input. I think the public hasn't been involved enough in the whole situation of long-term care. And we need to also coming up with ways that people can stay in homes or in home-like places as long as possible. This means fighting together for what we want, not just accepting what the government offers, which is a lot of work, to tell you the truth, and a lot of pain, but somebody has to do it. Also trying to get the government to give adequate budgets for quality care and home care resources or small alternative home-like solutions. So that's, I think, the last one.
Great. Well, thank you so much for this fantastic presentation. The MCSA Education Committee would like to thank you and everybody who tuned in today. I put a few links down in our chat box. We have the link to our Eventbrite page. We've added some new dates, some new events that are going to be coming up in November if you'd like to go take a look and register. We've also put the link in our chat box for just a brief survey. We would love to hear your feedback about today's event or any other Brainy Boomer event that you've attended. And in case that you've missed an event or maybe you want to go back and listen to get some more information, we've put the link for our YouTube channel in the chat box as well. So thank you so much one more time and have a great day, everyone.